mental illness, and the individual's ability to recognize early warning signs and take appropriate action will go a long way in the promotion of the mental health of that person. To address the topic this afternoon, I have the privilege of having two mental health professionals on this platform. First on the list is Dr. Naya Igegbara, a fellow of the National Postgraduate Medical College of Nigeria and West African College of Physicians. She has interest in adult mental health, particularly women mental health. She has over 15 years in practice of psychiatry, 8 of which has been in the capacity of a consultant psychiatrist. She's also a volunteer with mental health-based non-governmental organizations like Mind Trust and Suicide Research and Prevention Initiative. The second on the list is Mr. Timothy Alabi, a registered psychiatric nurse of about 25 years in practice. He has postgraduate diploma in public health management and child and adolescent mental health nursing. He is the chairman of Association of Psychiatric Nurses in Nigeria, Lagos chapter. Kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar.
Thank you so much, Dr. Weir, for that welcome. I know that we have quite a lot of people on the platform today. The medical director is not here, but I know that she had joined this webinar. Good afternoon, Ma. It's a pleasure having you. And so many other people also that had joined from various places. We know that we have some people who are yet always joining this webinar. We are grateful. It's because of you that we keep doing this all the time. So thank you for being part of this webinar once again. I want to start off by asking, how are you? Usually when people ask you, how are you? The standard response is, oh, I'm fine. And then we just leave it at that. But now it's just beyond how are you? And then we want to really understand, how are you doing exactly? Can you just put a comment in the chat box to tell us how you have felt in the last few weeks as regards your mental health? Please drop comments about fine, good, sad, unhappy, angry, whatever emotions that had emanated in your life in the last couple of weeks or days that we have had this protest and every other thing. Please put it in the chat box. And don't also forget that we are also streaming live on Facebook. So if you can't join on Zoom, please join on Facebook too. And please share the word across to people now that they can join us, because what we are discussing this afternoon is something very, very pertinent to the mental health. I can see comments. Yes, I'm fine, coping adequately. We'll get to that as we move on. So we'll go quickly into the discussion today, and then we're going to call on Dr. Naya Egegbara to start up the discussion this afternoon to tell us about you and your mental health. Over to you, Dr. Egegbara.
Thank you, Kemi. Thank you for the opportunity to be a part of this platform. Let's start by understanding what mental health is all about. According to the World Health Organization, mental health is a state of well-being where an individual is able to recognize his or her own abilities, can cope with normal stresses of life, can work productively, and make positive contributions to his or her community. From that definition, it becomes obvious that mental health is not necessarily the absence of a mental illness or mental health disorder. So for one to be said to be mentally healthy, that individual needs to be able to learn without difficulty. That individual needs to be able to feel, manage, and express a range of emotions, from positive to negative emotions. The individual needs to be able to engage and sustain good relationships with others around him, and be able to cope and manage uncertainties occasioned by unplanned life events. So if an individual is having difficulties with these areas, that person may require the help of a therapist. But let's find out, how does the mind affect the body? Is there really a link? Oh, yes, there is. Okay, so the mind and the body work synergistically to optimize one's functioning. So the mind controls our thoughts. Our thoughts have a direct effect on the way we feel. And the way we feel ultimately affects the behavior and one's reaction to certain events. So when the mind is ill, possibly due to an underlying mental illness, it will negatively impact on the thoughts. The thoughts will negatively affect the feelings, and these feelings will have adverse effects on the way one behaves and the way one reacts. And this is why we need to pay attention to our mind and what we feed our mind with. But let's understand why all the noise right now about mental health. Mental health causes a lot of disability, a significant amount of disability in persons who have been diagnosed with any form of mental illness. There could be some disability associated with it. When I say disability, I mean that in the presence of a mental illness, that individual is not able to function optimally and may not be able to contribute positively to his or her environment. Okay, so mental health disorders are classed as non-communicable diseases alongside other diseases like cardiovascular disorders, illnesses like diabetes mellitus. And when you consider all these non-communicable diseases, research has shown that mental health disorders cause 28% of disability that can be associated with non-communicable diseases. That's a significant figure. And that is why we need to keep talking about our mental health and how we can sustain good mental well-being. So we'll be talking later on how we can actually prevent the onset of mental illness. But before we get there, let's enlighten ourselves about some of the causes or etiological factors associated with mental illness. All right, so biologically, it could be hereditary. That means if an individual has a very close relative who has a mental illness, that individual may, emphasis on may, develop a mental illness at some point in their lives, particularly if they're faced with stressors that are overwhelming for them. Also for the child who is in the womb, whose mother has not attended proper antenatal care and is not taking the proper medications to prevent trauma and illness in the course of the pregnancy or at the time of birth, this can predispose that child to developing mental illness at some point in their lives. Some other forms of head trauma due to accidents, infections to the brain, exposure to toxins can also precipitate an episode of mental illness. We also have psychological and environmental factors, which a lot of time work in synergy to cause mental illness in persons, particularly those who are already vulnerable to developing the mental health disorder. Such psychological factors include exposure to abuses. It could be sexual abuse, physical abuse, even verbal abuse. Okay, exposure for long periods of time to such abusive environments can actually precipitate a mental health disorder in such individuals. Psychological issues like due to loss, a significant loss of a loved one, loss of income or properties can also cause mental illness. Environmental factors, it could be due to discrimination, it could be due to moving to unfamiliar environments, it could be due to terrorist attacks like Boko Haram attacks. It can actually cause an individual to develop an emotional illness at some point in their lives. So how then do we prevent the onset of mental illness? Prevention, they say, is always better than cure. So we talk about the primary prevention, all right? There are things that can be done to prevent the onset of the symptoms. The common symptoms of mental illness will be enumerating as we go along. But primarily, things can be done to prevent the onset of mental illness. Let's start with a child in the womb. If the mother attends appropriately antenatal care, takes the right medications, there could be protection for that child from infections, from traumatic events that can predispose that child to developing a mental illness at some point in their lives. Going to the right place to give birth so that it's not a traumatic event for both the mother and the child can be quite protective, as well as providing a conducive and peaceful environment for growing up. Okay, an environment that is full of chaos is also not good for one's mental health. All right, so for adults, you could have programs at workplaces that could help adults to cope with stressors. There could be public health enlightenment in schools to talk to pupils and students about preventable causes of mental illness, so that such as use of psychoactive substances. So if they abstain from such, then the likelihood of having mental disorders associated with such substances will be prevented. For the elderly, one could set up centers where they could come together, community centers, day centers, they could come and interact with each other, because at that stage of one's life, they tend to feel lonely and left out. So if there's such a center, they could come and engage in activities and interact with others. That will help them to sustain good mental health. We also have secondary prevention. All right, with secondary prevention, detection of the signs and symptoms of mental illness is key, early detection, and then appropriate referral to a place where the individual can get appropriate care so that the illness or progression of the illness can be nipped in the bud. We also have tertiary prevention, where there's already a diagnosable mental illness that has set in. Now helping that individual to reduce the disabilities that could be associated with the illness, giving the proper treatment and helping the individual, to reintegrate back into the environment and become productive once more. All right, so these are some of the ways that one can prevent or reduce the disabilities that could be associated with mental illness. So it's important for us to note our mental health is very important, and we can work together, to protect it and remain mentally stable. Thank you.
Thank you so much, Dr. Egegbara, for that enlightening discussion on this topic. You would note from where she started from giving the definition to those basic parameters that we should know, to the point where she started talking about prevention. And prevention is not just an adult thing. She started by talking about prevention even from the womb. When a child is still in utero, there is a need for you to do proper things so that would help the child to be able to function. And then significantly, she also mentioned that it's not even just about people in the middle age, so all the people too needs to also be protected from breaking down even when they get older. And that's also very significant. We'll talk about all of these things, but please don't forget you can drop your questions and your comments in the chat box as we go on, and we'll be able to take it. Please don't also forget that you can also drop your emotions about how you have felt in the last couple of weeks or days in the chat box. We want to know how you're doing, and then we'll be able to take it up from there. We'll move to the next discussant, Mr. Alabi, who will also be sharing his thoughts with us on you and your mental health. Over to you, sir.
Thank you, moderator, for having me on the platform. Now, when my co-discussant was mentioning her point, she did mention that you need to recognize the early signs of a mental illness so that you will be able to make appropriate reports and seek help. So I want to mention at this point, what are the early signs of mental illness? By the time an individual sees himself or herself eating too much or too little, sleeping too much or too little, pulling away from people and usual activities, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared. Can also be an individual seeing himself or herself yelling or fighting with family and friends that they are being in a good relationship before, experiencing severe mood swings that cause problems in relationship, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, inability to perform daily tasks like taking care of your kids, taking care of yourself, getting to work, getting to school, taking care of activities of daily living. When it becomes a problem, then mental illness is setting in. Another thing is difficulty in working effectively in the office, poor relationship, poor results, to mention but a few. These are signs that will point to an individual that is deviating from mental health. And for you to be able to actually identify this, you need to have a good grasp of who you are. And that's why the topic is saying you and your mental health. So you must know how your system works. And by the time you see how your system works, you'll be able to identify that you're actually drifting from the norm. Now, like we have had you and your mental health, it also talking by implication that the responsibility is all yours to live mentally healthy. So what are these responsibilities that you need to actually find yourself doing? You need to talk about your feelings. You know that when you share a problem, it's half solved. So don't bottle your emotion. Don't bottle your emotion. So talk about your feelings. Do something you are good at. Keep active, eat well, keep in touch with the loved ones. Even if it's not physically possible to meet, you can do that on phone. Technology has made it very easy now. So the world is a global village. You can easily touch on others. Take a break from your work. If it is all work, all work without play, make a jack a double. So take off a time from work. Then ask for help. No, we are not created to be an island. So you need help of others. So ask for help when you need help. Accept who you are. Don't make a unhealthy rivalry. Don't compare yourself. A or B is like this or that. If you are fat, God has made you to be fat. If you are thin, God has made you to be thin. The only thing you need to do is that if you are too fat and your BMI is higher than normal, then you can work on yourself. So you don't need to get nervous about that. Then try to care for others. Try to care for others. When you care for others, you see the result, you are happy, and you take yourself out of the hustling and bustling of the environment. So that makes you happy. As long as you have things to do, there are still other don'ts in order to promote your mental health. There are some things you need to shy away from. I like to mention that being a perfectionist is not going to be the answer. You know, you don't need to be a perfectionist. Now, it is not bad to attain to excellence. It is not absurd to put your best into whatever you are doing. It gives way to being the best and consequently a voice in the scheme of life. However, it could result into positive or negative. The positive aspect is that it helps you to do the best to deliver the best at all times. It involves setting achievable goals that are smart. Negative to positive, failure to success, turning mistake to stepping stone, overcoming anxiety and worries, keeping stress as much as possible minimal. Now, the negative aspect of it is that if it is beyond standard limit, there's going to be dissatisfaction with anything less than perfection. There's going to be preoccupation, seeing mistakes as evidence of unworthiness, and it will result into distress, fear of making mistake, discerning, uncertainty, and anxiety about judgment from others. Another thing is poor posture. You need to avoid poor posture. It has a negative impact on self-esteem and mood, but good posture enhances good mood, positive attitude. It reduces fatigue, decreases self-focus in those with mild to moderate depression. Journal of Behavior Therapy and Experimental Psychiatry is my witness on that. Another thing you need to avoid is guilt. Guilt is a normal phenomenon that a child displays in normal environment. This makes an individual feel uncomfortable to commit offenses. If this is not properly managed, the guilty feeling can leave one, can come in when somebody leaves one legitimate thing to do another legitimate thing. So inability to draw timeline between. So when the guilt continues, it makes an individual to magnify problem. You know, an individual tend to begin to take responsibility for creating or solving problems that are not originally from you. And you begin to see yourself as unworthy for minor offenses, and it may graduate to not forgiving yourself. Another thing is lack of exercise. When you live an all the way sedentary life, is going to have a negative impact on your mental health. So sedentary life should be avoided as much as possible. It has line, the heart, the ripple effect on your mental health. And according to Central, exercise is nature's mood enhancer. When you exercise yourself, the feel-good hormone, which is endorphin, is released during exercise. And it also helps us to suppress immune system that worsen depression. It decreases body temperature for a calming effect. It brings about confidence, distracting mind from worries, and the ability to cope with life stress, amongst others, a benefit of regular exercise. Another thing you need to actually avoid is failure mindset. Failure mindset. Of course, we know that the mind is a part of the body that houses our feelings. It cannot be empty at any time. So there are occasions when negative thought flicks in. It is not yet a problem until it becomes the norms. So the resultant effect of that is that it weakens our ability to succeed. It also leads to sleepless nights and, of course, setback in achieving the goal that is set for the day, which, if persists, can lead to failure and emotional distress. Now, it also depletes ability to set goals for life. Hence, stop listening to the voice that is telling you it is all for you. Avoid you cannot voices and thoughts. Get the understanding. I mean, you need to get the understanding that life is happening for you and not to you. Another thing that you need to avoid is overuse of social media. According to Child Mind Institute, the use of social media produces anxiety, lowers self-esteem among teenagers. The Telegraph also reports issues relating to mental health. In a recent survey, 1,500 adult Facebook and Twitter users, in which 62% reported feeling of inadequacy, 60% jealousy out of comparison to other users, like 30% said using just two, that is Facebook and Twitter, only makes them feel lonely. They are vulnerable to developing depression and anxiety. Regret also is another part of it that has to be avoided, though it has a positive role to play in life. That is, if it's within acceptable limits. But if it's amplified and excessive, it has damaging effects on your mind and body. It can lead to lifelong depression, anxiety, sleep disorder, difficulty in concentration. It also prevents people getting involved in the preoccupation from re-engaging with life after failure. Uh, Another thing that you need to avoid is codependency. In this case, it is when you sacrifice yourself to making others feel better in life, with the mind that when the individual gets better in life, you're going to get helped. In most cases, it's not as straight as that. Sometimes, in fact, often time, you get disappointed. So the better mind to put up is that whenever you render help, you don't expect a return in case the worst happen. And so you'll be able to maintain your emotional life. Poor sleep is not good. Poor sleep is not good. Sleep is essential to the body. It helps to build physical and emotional stability. Body and brain recovers from hustling and bustling of the day, and you are able to get yourself prepared to face the challenges of the next day. So sleeplessness of 1, 2, 3 days can be so devastating on mental health. According to Sleep Health Foundation, 60 to 90% of patients with depression also have insomnia. National Alliance for Mental Health also found out that more than half of the insomnia cases associated with depression, anxiety, or psychological stress. So Harvard Mental Health data published by Harvard Medical School also said that treating sleep disorder can help relieve mental health symptoms. So getting too little sleep, taking caffeine before bedtime, stressful situation before sleep, use of electronic devices long hours into bedtime are thief of good sleep. And of course, you have to avoid it. So when you do this, you'll be able to promote your mental health. Thank you very much.
Thank you so very much, Mr. Labi, for that very enlightening information about what we can do. I don't know if you were able to pick. Yes, it looks like a long list, but the truth is, if you're able to do all that he had mentioned this afternoon, and what we are saying is a better life, a better mental functioning will be yours. There was something particularly he said that I was able to note that. I said it is not a problem to fail, but after failure, if you fail to engage life again, then that is where there is a problem. Oftentimes, when people fail at one thing, the mentality is they start seeing themselves as a failure and then they're not able to push through. When that happens, then there is a problem. And so, with so many other things, he talks about sleep, he talks about diet, it talks about being able to function and push through life effectively. Please don't forget that we would be also be taking questions and comments in the chat box. So please let's send that to the box. Before we start taking questions, we have a lot of questions here now. I want Dr. Owoye to share with us, why is it that sometimes same event, same scenario, same situation, but different people, one tilts to the other side, and then the other one is able to bounce back, is able to function, and you begin to wonder, why is this person breaking down with a mental health condition? What is the problem? What is in this individual that makes them to break while the other person is still standing? Dr. Owoye, what is the change? What is it about these two different people that brings about this difference?
Thank you very much, Mrs. Akintoye. You see, in life, there is no way that there won't be challenges or major life events that may want to tilt somebody over onto the other side of mental health. So when an individual experiences or encounters major life events, the type of reaction and the level of reaction of that individual to that major life event depends on the genetic constitution of that individual. There are some people who can withstand adverse events because of their genetic makeup. That is one thing that I want us to really know. Another thing we need to know is that as an individual, when a major life event occurs, you must know that it has expiry time. So there is nothing in life that is without a change, okay? So they are bound to be a change after the adverse experiences. And once you have this opportunity, you know that, okay, despite all circumstances, what you are passing through now, you will be able to overcome it with time. Also, your psychological reaction also matters to major life events. For example, when you see an event and you know that it's challenging and it's difficult to face, why don't you put in your little effort and leave the rest? Your effort may be sufficient to address the situation and may not be sufficient to address the situation. All you just need to do is to make sure that you do your best and leave the rest. And not that alone, you must have a realistic estimate of your own ability. Not that you do what you think you cannot cope with. All these things are very, very important in response to major life events or challenges that can make or mar an individual. Thank you.
Thank you so much, sir. Individual genetic makeup, our experiences, the things that we have passed through in life can either make or mar us, depending on your mental position and your ability and attitude and belief and everything in be able to do this. Once again, we appreciate everyone who had also taken time out to join us today. You are part of the success that we are recording in Yaba Voice because you keep joining. Each time we send out flyers for webinars. And so we appreciate you for being here. Please let's send in questions and comments, things that we want to know about mental health issues. It's something that we really don't talk about in our society. Anytime people say mental, you don't even want to know whether it's mental support, whether it's mental awareness. People just start running away. But we are here to provide quality mental health education to create more awareness and more support so that we can destigmatize the issue of mental health even in our society, and people will be able to access better health. Dr. Igegbara, in the last couple of weeks, maybe days now, yes, we started with the protest, and then there were lots of issues about shooting and every other thing. And that has also affected a lot of people's mental functioning. We opened the Yaba Voice online platform for people to be able to call in. And the number of calls that we got showed that, yes, people had gone through really, really very traumatic experience with what had happened. I want you to share with us, for people who had gone through these experiences, what can they do? How can they better manage themselves to be able to better function and do well, even after now?
Thank you, Kemi. The recent events in Nigeria started with the peaceful protest by the youth, but unfortunately it was hijacked by some hoodlums. And there were lots of riots, there were lots of disruptions of lives and properties. So this is one of the unplanned environmental factors that can actually trigger an episode of mental illness in individuals. But with these recent findings, yes, people have gone through traumatic events. Some people have experienced significant loss of sources of livelihood, loss of loved ones. So it is only natural that they go through a period of grief. Typically, grief period goes through 5 steps. There is a denial, there's the anger, there's a beginning, then there's a depressive phase, and then there is the acceptance. But I need to note that grief is personal to each individual. It's not everyone that must go through these 5 stages. And the period of time it takes for an individual to navigate through these stages of grief also differs. But let me highlight what each stage briefly, what each stage entails. The denial stage, in that stage, the individual is still trying to come to terms with what has happened. So the individual may feel, oh, that they are still dreaming. Maybe when they wake up, everything will get back to normalcy. Now, this is not really a bad thing. It just gives that individual some time to psychologically process what has happened and what is going on, to be able to then know how to get over it. Following this is the stage of anger. Sometimes it comes as rage, but sometimes it could also come as resentment towards some organizations, towards some individuals, all right? So from there then is the bargaining stage. For individuals who are religious, they could begin to make a bargain with God or a higher creature to say, okay, make promises of what they will do if God helps them heal or have restoration over what they are lost. Then there is the depressive stage. This is a quieter stage, and this is a stage where the individual needs to pay attention to, and those around the individual also need to pay attention to, because at this stage, the individual is more retrospective. The individual tends to self-isolate, but there are warning signs that things may not be going right, and that individual may need the help of a therapist. For example, if the individual begins to express having strange experiences, such as hearing and seeing strange things others cannot see, if that individual starts talking about wanting to end his or her life, or how the future is bleak, or cannot sleep very well, then that individual should quickly talk to a therapist. Then beyond that is the acceptance stage. The individual begins to think logically about how to take steps to recover. So when an individual is going through these experiences, following such traumatic events we have experienced in Nigeria in recent times, it is good to talk about it. This is not the time to feel that you need to be a man and not cry. If you feel crying can help you express the way you feel, go ahead and cry and you'll feel better after that. Look for somebody that you can confide in. Talk openly about the way you feel. It makes you feel better. You should take a break. Don't immediately plunge into wanting to start up another business or how to, recover from whatever loss that may be. So you may decide to take a break from the environment. Look for a very neutral place where there will not be immediate reminders of the event that has taken place. Buy some time in taking that step. Time is a very good healer. With time, the pain will definitely ease. So take that time out. But that is not to say that you should be in limbo and not begin to take the necessary steps to recover. No, that is not what is encouraged. It's just a break where you will have people that love you and who will support you at this time. Then look out for support groups. There have been platforms made available by the government, made available by some NGOs where people can get onto, that they can help them recover whatever material loss or emotional healing that they may need. So look out for such support groups and engage in such. Then those around these individuals, be empathetic. If you cannot be physically present with them, call them up regularly, find out, genuinely show interest in how they are doing. Do not minimize their expressions of the way they feel. Do not make such insensitive comments like, it can't be that bad. You need to get over this. This is not the time to cry. Don't shut them up. Allow them to freely express themselves. All right, but beyond it all, bear in mind that every storm runs out of rain. This too will pass.
Thank you so much, Dr. Egebara. She shared with us one, the fact that yes, acknowledge your feeling. Acknowledging your feelings of yes, I'm sad, I'm unhappy doesn't mean yes, you're not strong enough. So acknowledge. If you need to cry, cry. If you need a shoulder to lean on, please get someone that can support you. Let somebody be there to help you pull through. So talk about it. Don't internalize it, because when you do, you're also adding more problems to what you're going through. And then again, she now said, be empathetic for everyone around them too. You can be a shoulder. So when they need to lean on you, please don't move away and tell them be strong when they don't even know how to do that. But then she now said something very fine, like, and it's like, yes, this too shall pass. I'm adding that to my own personal mantra too again. This too shall pass. So whatever it is that we're going through, it might not be the protest, but something else more challenging or something challenging going on in our life. Let's understand that this too shall pass. I'm going to ask Mr. Labi, while he was talking earlier, he said self-acceptance, and then I want us to be able to make it more clearer. Is there a way we can balance self-acceptance with motivation? The need to aspire to do more. Or yes, if I'm here, I should just accept I'm here, because yes, that's part of what he has said earlier. But is there a need? Can I aspire? Can I push? Can I want to become a better person?
Thank you. Accepting yourself is not actually accepting defeat. I'm not actually talking about complacency, but I'm also talking about accepting what has come as at that time. All right, you accept what has come as at that time, then reappraise, reassess yourself, then reset your goal in an achievable way, and then you move on with life. Because if you don't accept as it comes that way, you are most likely to break down emotionally. And when that happens, you will not be able to maximize your potential. And your contribution to the environment, to the community, will not be there. In fact, if you cannot take good care of yourself, definitely you will not be able to take good care of others. So it's not really talking about accepting failure, but just accept what has come as at that moment. On the other way, I talk about people thinking that they want to be bad, they want to compare themselves to another person. No, every individual has his own makeup. All right, things happen differently to different people. So when it comes to your way that way, one thing you need to do is find a way to work on it. Work on it to get better. You can always get better. If it has not happened, it will happen. Between your takeoff place to your destination, there are several bus stops. Just learn to enjoy each bus stop as it comes, and eventually you get to the destination.
I don't know if you heard that. He said, if it has not happened, it will happen. Between here and Yanopaja, there are various bus stops. And so you can always just, yes, you may have to alight, but then definitely you would get there eventually. And so please, let's also take that, especially when challenges and situation comes upon our path, and then we're finding it very difficult to move. Just know that this is the bus stop. You have not gotten there. And so you can keep pushing, keep aspiring until you get to where you want to go to. Why at the same time managing your expectation in such a way that you're better able to cope. We want to thank everyone for the feedback, the comments, the appreciation. Yes, thank you so much. But we still love more comments, more questions, and also want responses from you on how well you have been doing. Dr. Agebara, there's a question here from Akini Irotibi that says, please, what can a person do if his morale is down when he performed low and his colleagues are abusing him that is not like his father? Dr. Kinney, that's from you. Dr. Gebara, what can this person or what can this individual do? Or maybe several individuals might also be in the same shoe.
We talked about self-acceptance. Do not let people's opinion of you form the image that you have of yourself. Understand who you are. The persons that are criticizing you also have their own deficiencies. A lot of times, people try to cover up their own shortcomings by passing negative criticisms against others. That is a negative way of getting themselves to feel good and make themselves feel that, oh, after all, others are also inadequate. So do not let those sorts of opinions define who you are. Sit down and assess yourself. You will be able to see the positive factors that you have in you. It's important that you recognize it. If you're feeling so low that you cannot see those positive attributes that you have, engage a therapist to talk about yourself. This therapist will, in an objective way, help you refocus and help you to see those positive areas that you have, and will help you see how you can work on them, to elaborate on them. So do not dwell on any shortcomings you may have. Everyone has one form of shortcoming or the other. But by the time you dwell on it, you will be neglecting your positive attributes and the beauty of those positive attributes. Focus on them and how to work to grow them. So my take home to this person who has asked this question: refrain from letting people's opinion of you define the image that you see of yourself.
People's opinion should not define the image of you that you see. You are the determinant of who you are. And so sometimes in various situations, people would always come with their personal opinion about you. But what you believe about you is the most important thing. Can we just please unmute Dr. Weye? There's a question here about facilities aside from Yaba. I want him to quickly take on that so he can reel out other facilities aside from Yaba where people can access help before we move on. Dr. Weye.
Thank you very much about that questions on where you can access help whenever there are challenges. Irrespective of where you are, we in Federal Neuropsychiatric Hospital Yaba, we have online means of supporting people with psychological problems. So when you get to Yaba Voice, you will see all our contact details. You can call, you can arrange a meeting, you can book an appointment. But if you are outside Lagos and you need to see somebody, an expert physically, there are many psychiatric hospitals all over Nigeria. We have one Federal Neuropsychiatric Hospital, Aro. We have one in Benin. We have another one in Calabar. We have another one in Enugu. Then we have in Kaduna. We have in Sokoto. We also have in Maiduguri. And all these facilities are there for you to access mental health services. Not that alone. Also in all the teaching hospitals in Nigeria, in all the various states in Nigeria, we also have mental health departments of those places. So you can access your mental health services through any of those centers. So we have quite a number of them, and we want you to make the best use of them. But if you're in Lagos and the environment, why don't you book an appointment with us? If you want to come physically, we'll be glad to attend to you. And if you want us to help you online, we are also there to support you. Thank you.
Ayodele Oluwatoyi, thank you for your comment. She said, my family is currently undergoing some psychological stress that seems so overwhelming and distressing, but I have learned one or two things from this presentation today. Thank you so much, Professor Badru. Thanks for your comments on the self-esteem thing. Self-esteem and assertiveness are crucial. Yes, telemedicine is important, and that is one of the key. And that is why Yaba Psychiatric Hospital had also moved to the online platform, and that's why we're doing more of what we're doing now, so that yes, we can better educate people and enhance their knowledge and give more support, yes, online about it. And so the online platforms of the Federal Neuropsychiatric Hospital have been posted on the chat box. If you need to link up with us, you can always send messages through the Twitter, the Instagram, the Facebook, and then our numbers are there. You can send a message to us, and then we'll be happy to attend to you. Dr. Egegbara, there is a question here on erectile dysfunction, which has been around for long, with approximately 50% of men and suffering from this. And then 70% of men who are taking medication have high blood pressure and diabetes. What are the professional therapies available to help improve the psychological or the psyche of men with this issue?
Okay, thank you for that question. Well, erectile dysfunction is when a male is experiencing difficulty sustaining penile erection. But a number of factors could contribute to it. There could be underlying biological factors. That means maybe the blood to the organ is not flowing adequately. It could be due to some illnesses like diabetes or some other illnesses. There could also be a psychological component to it. So when we come across such cases, it's usually managed as a multidisciplinary case. So the therapists will have their own role to play in addressing the psychological component of the dysfunction. But we also need to engage a urologist who will help to assess that individual to make sure that there are no underlying physical illnesses that are contributory. But of course, some forms of medication an individual is having could also have an effect on that person's erectile functioning. Therefore, when we're assessing, we need to have a good history of what medications the person has been using, what medical history the person has had, and then with all of that information, working with a urologist will be able to help such individual.
Thank you, Dr. Yabara. So she had said it's not just a one-dimension thing, but yes, psychological help can be brought in to help people to undergo and to also be able to function very well. Yes, we know that health cannot be complete without mental health. That's a good one. But then I also want us to look at, there's somebody sent a question as a text message, and that's the fact that a lot of people are also having lots of psychological issues due to the fact that they have been isolated for a long period of time. Unfortunately, the expectation is that very soon everywhere will be opened up, but then news is now coming back again that there is a second wave of the pandemic everywhere. How can this individual cope? He said, I am becoming more anxious than even the first time because I am scared of what the effects might be. Dr. Egbara, how do we help this individual cope better, especially with all the news that is flying around now?
Yes, isolation, especially when it's for a protracted length of time, is not usually very good for one's mental health. But when it's inevitable, especially when the isolation is required in order to curb the spread of such a virus as coronavirus, then we have no choice but to comply. But while self-isolating, there are things an individual can engage in to ensure that they're mentally stable. Don't be idle. That you're self-isolating does not equate to being idle. There are activities you can engage in your home. Try not to just lay in bed all day, mooning over the situation. Simulate your normal, regular day as though you were actually going out. That is, sleep for the number of hours you would normally sleep if you are going out to work. Wake up, dress up, engage in positive activities. If you look around you, there'll be things to do. You can engage in physical exercise, all right? So you don't necessarily have to keep yourself locked indoors. You should be able to come out and have some fresh air, have the sun come on you a little bit, and then while you're self-isolating and social distancing physically, you don't have to social distance emotionally. That means you can keep in touch with people, okay? Thank God that there are now a lot of platforms that we can use to interact with people that will cost us very little where the cost of data is concerned. Call up those friends that you have not spoken to in a while. Catch up on what's going on. Call up your family members. Find out what is going on. Talk about the way you're feeling to others. You'll find out that you're not alone. That's the most important thing. Know that you're not alone. This is a global pandemic that is going on. But when you discuss with others, you could also find that there are ways others are using to cope. then find the way some of those coping mechanisms can suit your own environment where you are. All right, so try to simulate a normal day. Get up, don't lie in bed idle. Dress up, engage in physical activities. Find things that you enjoy that you have not had time to do because you've been chasing money all over town. Engage in those things. Are there new skills you can learn? Get to YouTube. Did you want to know how to bake? This is the time. Get on YouTube. Even if you don't have all the materials, use whatever you have and simulate, the baking activity. There are so many things to enjoy. If it's singing you love doing, this is the time to sing your heart out. All right, so be busy. Keep a positive mindset. This is not here to stay. The virus will eventually fade away. Reject the negative thoughts that are coming and keep away from social media. Minimize your exposure to social media, especially the negative content. All right, so minimize your intake of negative information regarding the effects of the pandemic. So I'm sure if you carry out these activities, in no time at all, you find that the self-isolating period is over and everything is back to normal. So we keep hoping for the best.
Thank you so much, Dr. Egebara. That's wonderful. But she said something very right, and I started laughing. She said, the things that you have not been able to do because you have been chasing money, this is about the time to do it. So it's like a period to take a pause and then find out what else can I do now? How else can I better engage myself? And that would help you to be able to move on. And finally, she said, you are not alone in all of this. Everyone is currently undergoing one emotional reaction to all of this thing that is going on. So please connect with people around you, share your thoughts. Rebook negative thoughts, reject negative thoughts, deal with negative thoughts, and keep pushing, and then you're able to function. Okay, I want to have a closing thought remark from Mr. Labi. What's your closing thoughts on all of this topic that we had discussed today, Mr. Labi?
Thank you, moderator. We've been able to talk to us today that staying mentally stable, the responsibility is all yours. You have to take responsibility because it is you and it is your life. No one can live your life for you. And there's a saying in Wisdom Palace that the way you lay your bed, the same way you lie on it. And I love to also tell you, situations that are around now brings about more failure and disappointment than ever. But I still need to reiterate to you
Hello,
that
let me
failure
see the
is not
people
the end of
online. I
life.
don't want to
Let me
touch
share
my
this
phone.
with you. Abraham Lincoln, one of the best presidents of America,
Those are online.
failed election for 8 good times. And then business he failed 2 good times. But you know what? He didn't give up. Eventually, he became one of the best presidents of America. So if you keep pushing on with life and thinking that you will get there, you will actually get there. And we have shared with you that if there's anything,
Oh, that's a lot.
if there's anything that bugs your mind, try and share it. Don't bottle your emotion. When you share it, then you feel relieved. Once you don't bottle the emotion, then you are halfway done. Uh, you need to also relate to people around you. When you need help, nobody has it all. Nobody has it all. So get help from here and there. And you don't also need to bite more than you can chew. Don't bite more than you can chew. And as long as you take one step after the other, surely things will get whatever your expectation is. And of course, you know that when you are going upstairs, you don't get there just immediately. You take a step at a time. And when that is ensured, success is really, really sure. So whenever you also notice there's anything, any sign that you have mentioned to you before, you need to make reports. And seeking for help is always good when you seek for it where it can be given to you. Because some people go elsewhere, enter scatter, and they get almost started before they get to where they will get the help. So the facilities where you can get help have been mentioned all along the seminar. So ensure that you get help your mental health, and then you'll be able to promote your mental health.
All right, thank you so much, Mr. Alabi, for that wonderful wrap-up that you have given us. On this high note, we will be wrapping up this wonderful webinar today. Once again, I want to appreciate everyone for taking out time to join us today on this webinar. It's been wonderful having you here. Without you, we can't continue, we can't sustain this. But please, what we always say, let's share, let's like, let's make comments on our platform so that people can, yes, benefit more. The essence of all of this is not just for us in Yaba alone. The essence is for us to be able to disseminate information all around to people so that they can have better information and then they can access the help. Remember, we want to, as much as possible, destigmatize mental health so that we can better function and be able to push through. Once again, on behalf of the Medical Director, Dr. Osi Ogun, and the Head of Clinicals, Dr. Owoye, who is also present here in this webinar, and every member of the Yaba Voice, we hope to see you at our next webinar, where we'll be talking about aging. And then when we look at that topic, I'm going to ask myself, I am a phobia. I don't like aging. Maybe when I was younger, I needed, but now it's like it's coming with lots of responsibilities and things like that. And I begin to ask myself, do I really want to get old? Some of the complications and every other thing. But when we look at that, I'm looking forward to that webinar where we talk about the process, we talk about all the things that are associated with the issue of aging, and then we'll be able to push on. So until we come your way again next time, thank you so much for being part of our webinar. We are happy to have you. Please stay safe. Remember, the coronavirus is still out there, so ensure that you protect yourself and then you also protect your mental health and make sure you have adequate mental health checkup. Thank you and have a lovely day. Bye-bye.